Beatrice Ogola, for record purpose, from the Kenya Medical Practitioners and Dentists Council, Honorable Speaker, that registers all our health facilities. The total number of health facilities registered in our country are 14,876, out of which public facilities are 6,005. Two, on the same, and the leadership and the Council of Governors is coming back to us. And COG is working with SHA to ensure that they update their bank accounts, particularly for the primary health care. And two, still Ogola, SHA has a database with a very active number. Now the ones who are registered under SHA, both public, private, and faith-based, are 10,451 facilities, with each one having a provider portal right. And payment for these facilities is dependent on the claim review process. Every claim on our dashboard in our system, even when it is rejected, it will give you the reasons why it's rejected. If you have not submitted required documentation, it tells you submit the following documents within 14 days. And different claims are in different stages. Some have just been submitted, some are under review, some have been approved for payment. So it's like a whole ecosystem, and that's why we call our digital system, we call it the digital super highway. When I come to the question raised by the leader of majority, Senator Aaron Cheriot, I agree with you, we will comply. We will comply with the law, and we will, Honorable Speaker, through you, we will give this House any information that is required within the shortest time possible, and I'm sure the members and the chair and the vice chair of the Health Committee know that whenever I am called, I appear. Just for example, to give you, under the PHC, the primary health care, which is exchequer funded, a very unique thing under this leadership. The problem, people who are opposing SHA are not the patients, are not the health facilities, are people who have a problem with the government of President Ruto. And we have no problem with that. Because today as we speak, Honorable Speaker, over 27 million Kenyans have registered SHA. Mombasa leading, Nyeri number 2, Kirinyaga, Bomet. That's how I can give the list of all the counties. And under PHC, so far, the primary health care, we have given counties 5.6 billion since last October. And we are ready to provide county by county, faith-based facilities who attend to Kenya for this free primary health care. We have given them 745 million. We can give the list one by one. Under SHIF, county governments have so far, depending on how they do their claim, there are some county governments like Mombasa, like Nyeri, like Nakuru. And let me say Nakuru PGH is one of the best model that is implementing the social health insurance fund. Since October, Nakuru PGH and Coast General Hospital have received close to 1 billion shilling because they do manage their claims properly. The faith-based organizations have got about 12 billion. MOH, these are the referrals. Kenyatta University, MTRH, Madare, and all these. They have received 6.5 billion. The private facilities are the largest who have received under SHA, 29.3 billion. This report is ready. We can provide it to the House anytime we are required. The animal or the elephant in the room is rejected, and I want senators to listen to me, Senator Cheriot being. If you see somebody asking you, there are a lot of rejections, he doesn't want to come and face SHA. In SHA, we have relationship managers at the county level, at our headquarters. Our system gives you reason. We have men and women, doctors who do clinical review, who will tell you why your claim is rejected. But because they know those are fraudulent, those are frauds, and we are coming for them, Senator. Tell them we are coming for them. And why are claims rejected? I want to give you 5 reasons why claims are rejected. And once it is rejected, for the information of this House, we are not paying. Claims are rejected because there's no claim form. The law you passed here, the 4 laws, at the bottom of those laws, you have designed a claim form. So a claim form is a legal document. If a facility has not provided a claim form when they are asking for reimbursement, that becomes automatic rejection. If the facility has not given us itemized invoice, that is a rejection. If there are no discharge summaries, God forbid, let me pick on even Senator Cheriot or Senator Khalwale. You go to Nairobi Hospital, you stay there for 2 days, there's no discharge form. And it's deliberate because they want to claim 30 days when that patient has stayed for only 4 or 5 days. So if you don't give us a discharge summary on when the patient has left, that is a rejected claim. If there are no supporting theater, if a patient, a Kenyan citizen, who is a member of SHA, paid up member of SHA, goes to a theater for any type of procedure, and then you make the claim to the Social Health Authority for reimbursement, and you have not attached theater notes, doctors who are in this House will know that. I am not a doctor, but I read, and I learn from people I work with. If there are no theater notes, that's a rejected claim, and we will not pay. If there are no birth notification, if a delivery has taken place in any of our health facility in our country, the mandatory document is a birth notification. If you want us to pay for your delivery, whether or normal or cesarean, and a birth notification is missing, we will not pay you. We cannot confirm whether a child has been born, whether a delivery has taken place. It's rejected, Honorable Senator for Kericho. Upcoding. There are people, and this is a medical fraud. There are people, a patient goes for a small boil that takes about 1 hour. The claim they make is that they have done a bigger procedure by even cutting his hand. That is called upcoding, and the system will pick you, we will not pay you. If you convert outpatients into inpatients, that is the biggest fraud. There are Kenyans who go, they are treated, they go home, then the facility turns them into inpatients because they want to claim the bed. They want 5 days. But now, going forward, they cannot do it because now we have introduced a biometric. A Kenyan must go through the biometric when he goes to hospital, and he must go through biometric when he's being discharged. But before the biometrics, they were turning out patients, and we have got evidence of patients who have gone even to the DCI, who are saying, I went for a day. Why is this facility claiming 14 days? Honorable Senate Majority Leader, we will not pay. And please tell these people who tell about rejected, let them go to SHA, they will get all the explanations. As of today, there are people who tell you SHA does not pay. As of today, faith-based, and let me pick, and I want Honorable Kalwale to listen to me. St. Mary has been used for many months for political expediency. It became the talk in funerals and everywhere. I went and sat with the Bishop of St. Mary. I sat with the Bishop of St. Mary, with the whole of my team, including the bank manager. And we have shown our Lordship, the Bishop, that SHA has paid him 90 million shilling. We have given him the TT, the transfer. The balance that at time had was 14 million. We have paid the 14 million. It is you now to go and ask the bishop why he's not opening the facility. And the bishop was with me in a press conference. And I said it. And I said it. Let us not use, St. Mary for politics. And I'm saying it, and I'm sure the people of Kakamega are watching me. Look for something else. St. Mary is a closed chapter. You cannot use St. Mary based. We have the numbers. Before the end of the day, Senator Boni Khalwale, I have sent you on your WhatsApp more than 5 times. You did not respond to me. I gave it to Prime Cabinet Secretary. When nobody could hear, I flew to Kakamega. And I sat with the bishop. And we did reconciliation. We proved to him that we have paid him 90 million. If today I pay Nairobi Hospital, for example, and the management decides not to run the hospital and close it, that is not a function of the minister. For health. But for my brother Boni Khalwala, number 3, our system is real time. Number 4, St. Mary owes us 8.5 million, and St. Mary owes us 8.5 million, and all these were lodged in the month of October. By the 14th of November, our next payment cycle, if these 8.5 are verified, we will pay. But so far we are paid 114. And please help me. I'm sure this weekend you'll be in Kakamega. I want you to have a different story. To say that St. Mary, SHA has explained. St. Mary, the problem is the management, is the leadership, and I am ready to go with you. I am ready. But SHA is working. SHA is working.
Finish up the questions.
Mr. Speaker, SHA is working, and I have said, you can have a problem with the President Ruto's administration, but SHA is working. It is unimaginable every day between 25 to 35,000 Kenyans register voluntarily as members of the SHA Social Health Authority. The train has left. We will implement what many people could not implement because of many side shows. Senator Kathuri, my Deputy Speaker now on the chair, I agree with you. The faith-based settlement rate is at 69.
You know, Senator Mboni, why are you interrupting the CS? You know the CS is not even in the side of the House. That is why you cannot raise a point of order. Maybe after he summarizes his question, you can seek clarification. But not a point of honor to the CS. You know, please, Boni Kalwale, I told you, let him finish the questions. Actually, he's answering the questions for the US truly. You should be very quiet.
Thank you, Honorable Speaker. Honorable Speaker, your questions, yes. Faith-based hospitals, our settlement rate is 69%. Private hospitals, it's at 56%. Public hospital settlement is at 55%. And this is delayed because of poor documentation. But the matter that you have raised is very critical. And this is a discussion for the Senate and for the Council of Governors. The people who work in our counties, facilities, own private facilities next door. They own facilities. And I've told governors. So they work at the counties as retention. But they really do their business. And I'll give a good example of Kakamega. The number of patients seen in Kakamega public hospitals and the amount of drugs dispensed does not tally, which means the drugs are being taken to private facilities. And that's why I call upon this great house, which is a custodian of devolution, and which has a Senate Devolution Committee and Senate Health Committee, to go out, because health is devolved, there's very little I can do, and make sure, go see and ask what is happening. We have seen facilities we are closing that are owned by people who work in county governments. So we need to deal with that, Honorable Deputy Speaker, who's on the chair. Honorable Veronica Maina, yes, the emergency cover is active now in level 5 and level 6. We were doing a pilot phase, but I want to assure this House that the emergency cover will be up and running on December 1st to cover all emergency centers in all level 4. Our ambulance services within the ECCIF will be launched in December. And this is one of the beauty about universal health coverage. Never again will a Kenya on an emergency go to a hospital and he will be asked for a deposit. The emergency center we are going to establish will send the nearest ambulance to that Kenya who is in distress in terms of health. It will take him to the hospital. The ambulance is paid by SHA at the rate of 4,500 if it is a long distance in every 25 kilometers. And then when he's delivered to a health facility at any level, that Kenya that Kenyan, the first, he lost to Dr. Boni Khalwale. And he wants to use SHA to again for his political engagement in Kakamega County.